Hello guys, kind evening. How are we? I trust we are good. It's a wonderful Saturday evening. And remember I told us last week that today's Saturday, this week Wednesday, when I talked on menopause transition management, all right? I said this month of May we are going to shine lights on menopause transition management for most women out there to have better understanding, to also have better understanding of those types of symptoms that women might be experiencing, and while they are experiencing this, they normally don't know what is wrong with them, okay, what is wrong with their system, with their body. That's why today I said I'm going to talk on 34 symptoms of menopause. That's what we are going to talk about today. All right, I have talked on, when you go down my Facebook page, you see that I've talked on so many, a lot of the symptoms, but today I just want to mention these 34. There are still more, putting together all the symptoms that different women goes through or that they pass through during this menopause transition. Menopause transition does not mean that you are into menopause already, that your period, your menstrual cycle has stopped. No, it's a long process. Okay, menopause is a natural phase of life that every woman goes through, but it is, often accompanied by a wide range of symptoms that can vary in intensity and duration. That's where the issue is. Menopause is not an ailment, but the range of symptoms that comes with it is what we need to learn how to deal with, how to manage it, how to overcome them and get better and stay healthier. So today we are looking at the 34 symptoms of menopause that many women experience out there. All right, let me talk of the number one that is very, very common, which is hot flashes. Hot flashes is when you have this intensive heat from the inside, like kind of eternal heat, and you feel it in the neck region, in the face and your chest region. That's the area where you feel this heat, and it's very, very intensive. That when it's up just for a few seconds or minutes, you will feel like you are losing control of your mind, of your body, of yourself. Okay, that's hot flashes. And the second one is night sweat, when you wake up in the night and you see that you are soaked in sweat and you have to just change your bedspread everywhere. Your bed everywhere is soaked up, even your night wears you need to take them all off. That is night sweat, soaked in sweat, in your own sweat. Then mood swings is when you are good right now, the next few minutes your mood has changed, you become moody, you are angry, you were the one that was just happy 5 minutes ago. All right, that's mood swings for you. Then insomnia, when you cannot sleep at night, you find it difficult to sleep and the next morning you need to wake up and go to work. So that's insomnia. That's number 4. Fatigue, number 5. Fatigue is when any little thing you do, you are tired. You are not even doing anything. You are just sitting down in a chair, you are tired. You can't even do much. You are always tired. You're having pains all over your body. You are always tired. That is fatigue. It's also one of menopause symptoms. And then irregular periods. I've also talked on that. If you go down my page, you see that when your period begins to fluctuate, okay, it begins to skip. It can come this month and then in 2-3 months it's not coming again. That is irregular periods. It means that your period has begun to skip. Vaginal dryness, I've also talked on that. That's vaginal dryness. You have difficulties having sexual intercourse. You always feel that your body is dry. Not only feeling it, you know that it is dried. All right, that's vaginal dryness. And decreased libido as well, which is number 8. Decreased libido is when you don't have interest. You just lose interest in sexual intercourse because of the vaginal dryness, and all that also causes that decreased libido. It's like that the hormones that are responsible for that, they are just doing their own things. They are all fluctuating. So that is number 8, by decreased libido. Number 9 is weight gain. You begin to gain weight, especially in your midsection, your belly. That's when you see women begin to have belly fat. If you are not working on it, begin to have belly fat in your mid section. That is weight gain for you. Some can even accumulate fat all over their body, depends on an individual, but belly fat is one of those fats. All right, then hair loss or thinning. Your hair, you begin to lose your hair. Okay, your hair, you begin to lose hair at that stage because of the fluctuation of the hormones. Hormones, our bodies are filled up of hormones, and these hormones are what is responsible for all our organs in our system. All right, dry skin, I talked on that last week. I think last week Saturday. dry skin, and I told us how we can also manage dry skin. Is also one of menopause transition. Why am I telling us all these 34 symptoms of menopause? I'm saying it so that we'll be able to have better understanding, because when that process starts, we normally don't know. All right, we'll just be having different things that is happening to our body, but we really don't know it's menopause transition that have started. All right, I'm saying all this, mentioning all these symptoms, so that when by the time you begin to experience these things, you will know that menopause is knocking on the door and you have to work on it. All right, then joint pain as well. Joint pain is another bad one. It can cause you arthritis. There's something called menopause arthritis. Okay, so joint pain is also part of it. You begin to have joint pains all over your joints. If whether you are exercising, you are not doing anything, you are sitting in a place, you begin to have these joint pains. Memory lapses. You begin to forget things. Okay, you forget things even if while at the middle of a discussion, you forget what you're talking about. All right. Difficulty in concentration is another one. That is number 14. And number 15, anxiety. Anxiety is another strong symptoms of menopause. All right. Depression follows up anxiety. They are brothers and sisters. They work hand in hand. So depression comes after, when you are not able to manage that anxiety, manage that mood swings. Depression can as well come in. All right. Irritability. They are also in the same lineage. Yeah. Irritability is another one. That's any little thing you are irritated. Irritability. You really don't feel yourself. Okay. Breast tenderness, number 18. Your breast, you feel, sometimes you'll be thinking, especially when your periods begin to skip, when it's not coming, you'll be thinking you are pregnant. You are tenderness, this breast is kind of, am I pregnant? But you are not. You run a blood test. You are not pregnant. Okay, it's negative. Breast tenderness, headaches from nowhere. You have headaches today, you can take paracetamol. The next day the headache returns, or even you can take paracetamol in the morning. You can sleep and wake up and have headache. You wake up with headaches. So headaches is one of those symptoms. All right. And digestive issues is another big one. Digestive issues is another symptom of menopause, where you begin to have digestion issues. When you eat, there's difficulty for you. It's difficult for you to digest your food, because as well you are not also consuming enough fiber. It's part of it. We'll be talking about all this. Okay, bloating is another issue. Bloating is when you are not that fat, but you feel that your body is so tight. All right, you feel it like your body is kind of heavy. You know, that means that you are bloated. Okay, bloating is another one. Changes in body odor. Also, your body odor, it changes. There's changes in it. Your body odor changes. Okay, tingling sensations is another one. Tingling sensation, number 23. Remember, I'm talking on 34 symptoms of menopause. Okay, electric shock sensations. Electric shock. You will feel like kind of electric shock in your body. You feel this sensation from time to time. Okay, heart palpitations. Your heart begin to beat. You palpitate anyhow, and you know, when it's not well followed up, you see that at that age women begin to have they will begin to have BP issue, heart issue, cardiovascular issues. Heart palpitation is one of those things. Dizziness like a pregnant woman. Dizziness is another one. Changes in taste and smell. How the food you eat tastes and how you smell, there is changes in it. It differs. Itchy skin also work hand in hand with dry skin. Itchy skin. It doesn't mean that when I talked about dry skin, it doesn't mean that you've had dry skin all your life. I've had an oily skin right from time, but when the time came, my skin gets dried. All right, I have to work on it to bring it back, to give it back the normal texture that it normally have. You need to work on your skin at that time. Working on your skin, I'm not talking about you changing your color from black to yellow to fair person. Work on your skin, giving it what it needs from the inside, eating what we reflect outside, and using, at that time you need moisturizers for your skin, not bleaching creams. Okay, brittle nails. You begin to also have brittle nails. Changes in hair texture. I've talked on your hair, losing hair, your hair falls off, and also there is changes in hair texture. All right, increased facial hair. I am that woman that have beard, okay? So I shave like men, but just because I do use something that you cannot see, that's that dark spots there. All right. So if you're that woman that have facial hair, it will now increase. Okay, it will increase as you are aging because of this menopause transition. Okay, bone density loss. All right, you begin to lose your bone density. It's part of it. Then number 34, increased susceptibility to urinary tract infections, that you are more prone to contact infections. Know that these infections are just toilet infections here and there as a woman. Know that I'm not talking about sexual intercourse, infections that you can get during a true sexual intercourse. No, you can use the bathroom, you can use public bathroom, and you just get infections. So at this stage, you need to keep your house toilet, your bathroom so clean. All right, you need a clean environment at that time. Okay, so it's important. Why am I saying all this? It's important to know that every woman's experience with menopause is unique. It's unique. Every woman's experience is unique, and not all women will experience all these 34 symptoms I just talked about. No, not all women. You have some that you experience, some while some other women will experience. If everyone just did for one person, wahala. But there are people that have severe menopause, there symptoms. There are people that have mild one. Okay. However, being aware of the potential symptoms can help women better understand what they are going through and seek appropriate support and treatments that they need at that time. So if you are experiencing any of these symptoms, you are in it and you don't know what to do, you can as well chat me on my number, which is a WhatsApp number, WhatsApp only, +39 351 277 3637. I repeat, +39 351 277 3637. Chat me up if you really want to handle it organically, the natural way, not later you use things like hormonal therapy, doing things that later you will have side effects. Okay, with natural organic way, you don't have any side effects, and you will be good, and you will be fine, and you will be stronger, you will be healthier. That is what I used, and I'm still using. This is my part of products that I use. They help you stay healthy, they help you stay fit, they help you stay strong. You see all this dizziness, this all flashes. I had all these experiences. Most of these ones that I've mentioned were part of the symptoms I experienced, but glory be to God, I was able to work on them. All right, if you want to work on yours in a natural, organic way, without having side effects, without being afraid of what will happen next, just chat me on that number, and it will also be on the cover notes so that you'll be able to reach out to me whenever you want. So guys, like I said at the beginning, I'm not going to take much of our time. It's going to be a fast one. I have a lot to do. Yeah, I know it's weekend, but I have a lot to do. So see you guys next time, my next video, maybe tomorrow when I'm back from church, or maybe Monday. So thank you guys for being there, and lots of love. See you.